Hello everyone, myself Anil. Today I'm here to talk about the impact of artificial intelligence on healthcare, which is the topic of artificial intelligence. And let's see what are all the impacts of artificial intelligence on the healthcare. Abstract. Artificial intelligence changing healthcare in a big way by making a diagnostic better, by creating a smarter treatment plans and helping with all administrative work that happen behind the scenes. And this AI is being used now, and how the things like machine learning and natural language processing, which is NLP, and even robots are becoming a part of healthcare, and the AI is playing really a big role in the things like medical imaging and personalized medicines and stopping the disease before they start, which show how it could be really improve the patient's care and make the healthcare system and work in a better way in a overall. One of the most important area where AI is helping in a diagnostic, where smart tools that are used as the AI looking at a medical imaging like X-rays and MRIs to find the problems ways in the earlier than human can make it easier. It treats the illness and before they get worse. And AI will assist, and predictive tools are also helping doctors by giving them personalized treatments ideas, and even letting them monitor the patients from the distance. But there are still some issues like whether all these things are safe and how private the data is. Looking ahead, AI has a lot of promises, especially when it comes to things like discovering a new medicines or making treatments that are perfectly tailored to each patient. But these points, this will points out that there is no needs to some strong rules in the place to make sure things like bias, data, safety, and transparency are handled correctly, so that AI can be used in a fair and safe way across the healthcare. Let's see the introduction. Artificial intelligence or AI is really taken off in the last few years. It's starting to be used in a lots of different areas like healthcare, where ability to mimic the human intelligence by learning and solving the problems, like it's really useful, and it's opening up a new possibilities that people couldn't even imagine before, the like having a machine and read medical images and automatically, which helps the doctors to make a better decision about the diagnosis treatment. And by bringing AI into healthcare systems, there are a lot of benefits like cutting cost, making administrative tasks and quicker, easier, and giving the patient the better care. For example, machine learning algorithms can pick up patterns in the medical data that doctors might miss, which make a diagnosis more accurate. And NLP analyzes doctors will notes and patients records to give the insight that help with the decision making rights in the moment. But even though AI is being used more and more in the healthcare, there are some big challenges that came with it, like making sure patient that data stays in the private, stopping bias in the algorithms that could lead to unfair treatment, and making us make sure that everything is transparent and so people trust the technology. Let's see the methodology. This looks at the different types of AI technologies that are being used in the healthcare, like machine learning, NLP, and robots. And it goes into how they are being used and now, and what they might be able to do in the future. One of the key areas are discussed in how machine learning are used in things like looking like at a medical imaging prediction, or how the patient will respond to the treatment, and planning out the best treatments, which show how it changing the way doctors diagnose and take care of patients. NLP, or natural language processing, is another big focus, because it helps to understand the clinical and data, and it makes it easier for patients to talk and to AI chatbot and virtual assistants. These technologies are is also improving and way of medical records were written down the and organized, so it's simpler for doctors and nurses to access understand the patient's information. The last thing looked at the at this part is how the robots are being used in the healthcare for these things like doing complicated surgeries or helping the patient's recovery after an injury. This looks like at the robots are already out there in the like surgical robots, and how they are being used in telemedicines, which lets the doctor see and helps the patients for away. This part of the paper compares the success and struggles of AI-powered system in healthcare so far. Let's see the result. The result from the paper show that AI has really improved the healthcare in a lot of ways. Machine learning has made a diagnostic tool where more accurate, especially when it comes to the medical imaging, where AI can spot the diseases earlier than the traditional methods. AI-powered algorithms are also doing better job finding the patterns in the medical data, which cuts down the an on error and helps doctors to step in the earlier to treat the patients. When it comes to keeping the patients engaged, AI-powered chatbots and virtual assistants are make it easier for people to get the healthcare info wherever they need it. These systems are giving a patient personalized health advices and are making it easier for them to talk their healthcare providers, and the use of AI for monitoring the patients from far away is helping the doctors catch the problems early, which leads to the better care. The discussion part of the paper talks about the how AI is generally changing healthcare for the better, especially when it comes to the diagnosis illness, creating the treatment plans, and making the whole the process of running hospital or clinic more efficient. Both machine learning and NLP are have already proven that uh, they can make the diagnosis more accurate and lower cost and make everything run more smoothly. Robots have made surgeries and telemedicines better, and patients are recovering faster than thanks to AI. But there are still some big challenges that have to be dealt with before AI can be used everywhere. One of the biggest problem in the is the quality of the data, because of lot of AI models need huge amount of high quality data to work well. If the data is used in any bias in the AI tool, could make healthcare less fair for some people. Another problem in the cost of AI, because not all hospitals or clinics can offer the, especially the smaller ones. And this last part of discussion is about the how important it is to have the rules and guidelines in the place to make sure that AI is used ethically. It's really important that the algorithms are clear and easy to understand, that the patient data is kept safe, and that there are clear lines of accountability. People need to able to trust the system that are helping take care of their health, and make sure that there are ethical standards and laws in the place in way to do as an AI continues to grow. We came to the last part of this session, this conclusion. To wrap the things up, AI has the potential to completely change the healthcare by making the diagnosis more accurate, giving the patients better care, and making everything run more smoothly. Right now, AI has already showing the success, especially in the diagnosis and illness, and creating a personalized treatment where the plans, but there are still some big challenges like dealing with the ethical concerns, like keeping the patient's data private, and figuring out how to cover the highest cost of AI system. Solving these challenges are really important if we want to unlock everything that AI can do for the healthcare. Policymakers and healthcare professionals are need to work together to create rules that make sure that AI is used in a way that fair, transparent, and accountable. Making sure the issues like bias and in AI systems and protecting the patient's privacy and address has to be top priority to make sure that nobody harmed by the technology. In the end, with the right regulations, ethical safeguards, AI could completely transform the healthcare by making it more efficient, personal, and easier to access for everyone. AI could lead to faster discoveries of new drugs and more precious diagnosis and better outcomes for patient overall, helping to shape the future of healthcare into smooth something that work better for everyone. Thank you for watching this video. Thank you.